The number of coronavirus cases in our state is nearing 137,000, and other key numbers we're watching are trending in the wrong direction. And the race is on to find a vaccine for this virus. We're still months away from having one, but Maryland, they have a plan for when one is approved. WJZ is live this morning. Amy Kawada has more on who will be given priority before the general public. Amy.
Yeah, Max, good morning. Well, Maryland plans to roll out a phase system when it comes to determining who will be able to get the vaccine first when it is available. It will roll out in two parts, and the state health department says they want to make sure those who are most at risk are protected first, meaning frontline healthcare workers and people who live in nursing homes. As the world anxiously waits for a COVID-19 vaccine, Maryland unveiled a draft of its mass vaccination plan. Tuesday, Governor Hogan announced the plan of action that breaks down into two phases and focuses on availability and distribution once a vaccine is approved. The Maryland Department of Health says phase one of the plan focuses on priority groups, including frontline workers, people in assisted living facilities, and essential employees. Phase two will then open the vaccine to the general public, depending on availability and supply. Kurt Cito with the State Health Department says it's a plan they've been working on since April.
To make sure that we would have a plan that would be able to vaccinate all of Maryland who wants to be vaccinated.
The draft, based on information from the CDC, lists a number of components that go into making it a smooth process, like recruiting providers, inventory management, storage of the vaccine, and safety monitoring. But some are calling the plan into question.
A lot of these things are not, have not been thought through completely.
Michael Greenberger with the University of Maryland Center for Health and Homeland Security says it won't be easy to store and distribute the vaccine to everyone who wants it.
It's complicated by the fact that individuals will need 2 deliveries of the vaccine, 2 injections. And there needs to be money to support all this.
Officials say final decisions are still being made to the plan, and the state health department says although there is not a vaccine available just yet, they want to be as transparent as possible with the public, so when a vaccine is ready to roll out, they'll have a roadmap. Live this morning, I'm Amy Kawada for WJZ.
Amy, thank you. If you had plans to travel to New York, you may want to reconsider. That's because our state is back on the quarantine list. Maryland and Arizona were added to the list that now includes 40 states and territories. We were added because of our growing positivity rate. Now, under the order, anyone traveling to New York must self-isolate for 14 days or face heavy fines.